Smile.
Yeah. So what we're talking about is how to get action when we're calling those past due patients. They don't have appointments, right? And we want to get them in. Well, we know when we call them, we leave that message saying, hey, the computer says you're past due. It's been since. Give us a call. We'll get you scheduled. Well, when they hear that message at home, they go, yeah, I know I'm past due. Delete. I'll call them when I feel like it, right? Yeah. So what we have to do is we have to create a sense of urgency in that phone message. We want them to do something about the message. So let's keep it real simple. We call it message one, so write down message one. And message one is very simple. We want to make it impactful. We want them to think it's serious. So from the patient's perspective, who has the most power in the office? Which one of you here has the most power in the office? The doctors. Okay, so you need to make it like the doctor. You need to make it like the doctor's calling, right? Yeah. So what I would say is, I'd say, hi Heather, this is Eric calling from Dr. Campbell's office. Dr. Campbell asked me to give you a call. Please call me as soon as you get this message at 777-7777. Thanks, goodbye. Okay, let's do it again. So message one says, hi Heather, this is Eric calling Dr. Campbell's office. Dr. Campbell asked me to give you a call. Please call me as soon as you get this message at phone number. Okay, now you're the patient at home and you get that message. What do you think?
What's wrong? Yeah.
What could that be about? Is it terminal? I should call right away.
And they do call.
And they do call when you leave that message.
For doctor's treatment only. And I may make it, oh, Dr. Wheeler is very concerned. And if you can please call me back.
Good.
And they don't even know.
For unscheduled treatment, we're doing that. We have to do it for hygiene as well. Okay?
I give you permission to use my name as much as you'd like.
You are asking them to call these patients. You are. They're on the list. We got to call them. So now here they call back. Now what do we say? They call you back. It's called conversation one. So conversation one is a couple things. 3 things just to jot down. 1, 2, and 3. Number 1, it's been since, comma, were you aware of that? So you're using a trailer, right? It's been since date. Were you aware of that? Okay. Number 2 thing you want to check is a condition in the chart. So last time you were in, blank condition was the concern. Number 3 is test the buy-in. How concerned are you with that? Remember that from the case presentation formula? So number 1 is date. It's been since this date. Were you aware of that? Some sort of trailer there. So they go, oh my gosh, I can't believe it's already been 9 months. Holy cow. You know, they don't even, time flies, right? Number 2, review a condition with them, a reason for return. So it's something documented in their record as to what was going on. Last time you were in, you and Heather and the doctor were talking about the bleeding on the upper right.
Condition which...
How concerned are you with that condition? That's number 3. So in the past, we're working from a viewpoint of come in because I said so, because the computer said so, because you're past due, right? People buy for whose reasons? Their reasons. And what is the number 1 thing we have to sell them? The condition. So now that's the viewpoint we want to take with them on the phone is, this is the problem. How concerned are you? Well, pink in the sink, no big deal. Now you got to handle something on the phone. There's something for you to talk about. Okay, so we all have to be prepared to have that conversation. Or they go, oh my gosh, yeah, I noticed that it has been bothering me. I want to get in and have them take a look at it. We have to make it more than just a cleaning. If it's just a cleaning and you're overdue, it's no big deal. I'm going to delete the message in the answer machine. If it's something's wrong and I want to get in for this, I want to have a conversation and dialogue with them on the phone. Not get a phone call, how quick can I get on the off, boom, next person, checklist. That's not what it has to be about. It has to be a relationship about solving their condition and giving them a benefit to coming in. Otherwise, it's just a cleaning. Does that make sense?
Yes.
Okay. Will you guys do it?
Yes.
All right.